Now we look at the aspect of hypertension. So if a patient has hypertension, how can you be able to take very good medical history and also physical examination? Okay, so to say it might differ from region to region, but we're just trying to say in general, what are the things that you shouldn't miss out for a patient that has hypertension? So let's quickly, of course, this is the first thing you do in the hospital. Ask questions. You get information from the patient that has the symptoms. You also do physical examination to pull out the signs, you know. So to take a medical history, you are trying to focus on what are the things that actually made it possible for this patient to have hypertension in the first place. You're looking at the symptoms. You're also trying to look at the various things that the patient will complain about. So what they are complaining about, of course, it will give you a clue, you know, to what they are suffering from. So coming. So medical history for hypertension is when you're interviewing a patient, the following areas are very essential. Don't miss it out. So first, you get the reason why the patient came to the hospital. The primary reason. Was it headache? Was it dizziness? Was it chest pain? Was it palpitations? Was it shortness of breath? Was it blood vision that brought the patient to the hospital? Okay. Then you get try to know for how long that patient has been having that issue. Okay. So risk factors. So what are the other things in that patient's life that is making it easier for them to have that hypertension? Okay. So is there a family history of it? Their other family members, have they suffered from a similar condition? Look at the lifestyle factors like does the patient smoke? Does it take alcohol? You know, physical activity, is it that they don't really do exercise and all of that? And so past medical history, we are looking at if the patient has had diabetes, kidney disease, or thyroid disorders before, or vascular disease. Then also medical history, where there's we are trying to see if the patient has used steroids before, oral contraceptives before, non-steroidal anti-inflammatory drugs before. So complication and target organ damages, you are looking at the heart, if there's history of angina or myocardial infarction or heart failure. On the nerve side, you are trying to look at if they have had any stroke or transient ischemic attacks, you know, kidney disease. There's reduced urinary output, swelling, and also the ophthalmic and the visual disturbance side, and also retinopathy. So on the eye, you are trying to find the complication in different other systems of the body too. Hypertension sends a lot of complications to different places. So you are trying to establish those complications. You're also trying to know where they work, how much stress they are exposed to, how rich they are. Okay. And this will make you know that if I prescribe this drug, the patient can be able to afford and buy. Do you understand? They do systemic review, okay, where you go over all the other systems of the body to see if the patient has issues in them. So for physical examination, things you should do include you measure the blood pressure, okay, you take readings in both arms, okay, and you can tell the patient to stand, and you can tell them to lie down. You take the various readings while they are standing, while they are lying down. So general assessment, you look at their height, their weight, their body mass index, their waist circumference. You look at if there's any sign of obesity, the patient having weight, too much weight, then also metabolic syndrome. Then in the cardiovascular system, you look at if there's jugular vein distension. Then you look at the pulses. You count the pulses. Then you listen to the heart if there's murmurs, if there's gallops, if there's breaths, all those abnormal sounds. You know. Then in the respiratory system, you look at if they are breathing very well or they are finding it hard to breathe. You also look at their abdominal assessment. You are trying to look at if the you know kidneys are enlarged, okay, or abdominal breaths, or the spleen or the liver is enlarged. The neurological system, you are checking for reflexes, motor strength, and cognitive function. The eye examination, you are looking at fundoscopy, looking for hypertensive retinopathy. The peripheral examination, you are checking for edema, skin changes, or peripheral vascular disease. So, not to mention all, but to mention the things that you shouldn't miss out. Okay, as you are doing medical history for hypertension.